Welcome back to Profiles in Caring. Doug Jardine now reporting from the East Coast, Rockhill, South Carolina, and on a great local nonprofit, Hospice and Community Care. No question about it, we will all die, and who's at our bedside when that happens I know is important to me, and I would imagine is also important to you. And that is the premise here at Hospice and Community Care as well. A great staff, a great volunteer staff, and an Ambassador of Caring award-winning staff.
But I got a call in October, and she told me that she wanted me to do her a favor. She said, would you please call my doctor, her oncologist, and tell him I'm not going to take treatments anymore. Now, when you have seen a person fight as hard as she had fought, and her to tell you she wasn't doing it anymore, it was a real shock. And so we did that for her, and within a day, she was here at Hospice Community Care. And when we told her that she could come to Rockhill and be here at Hospice, she looked at me and she said, you mean I can come home to die?
Battling first breast cancer and then bone cancer, Linda knew her sister was extremely uncomfortable and in constant pain. So for her to contact a hospice in Rockhill, South Carolina, close to home, close to family, was an easy favor to carry out. And she says, fortunately for them, they found a hospice which is also a nonprofit, Hospice and Community Care.
We accept what Medicare pays, what Medicaid pays, and what private insurance pay as payment in full. Then we assess a person's ability to pay, and if they don't have the ability to pay, we care for them regardless. We have, I think now, about 400 volunteers. And they do everything from copy paper and put together booklets to caring for our patients. We have a group of volunteers known as vigil volunteers who sit with patients so no one will ever have to be alone when they die.
And it turns out a very patient and understanding staff, because even Linda will tell you her sister was a little bit stubborn when she arrived here.
When she first got here, and this went on for almost 2 months, I think, she refused to get in bed. They allowed her, and that's the point right here, is that hospice allowed my sister to make her own decisions in her own time. And that was something we didn't understand.
I've been a volunteer for about 9 years, and one of the most important things that I do that gives me a sense of really touching lives of families and patients is doing what we call vigil, and that's sitting with them during their last moments and helping the family to make that transition. It's such a difficult time for family members when they know the end is near.
As a nonprofit, Hospice and Community Care could simply not do anything here without their incredible volunteers like Lee, Tom, and Ann. They are really the difference makers, literally on call in efforts to make what could be the last hours, last days, or the last couple of months of somebody's life the most comfortable they can be.
I see a real calling amongst the patients, families that are here, and it's a privilege to be able to be working with the public. I was in the retail business all my life, and I enjoyed people, and so I come to the hospice house with the desire to encourage people, strengthen them, be a help to them spiritually, physically, in any way that I can.
I help in the kitchen I help the CNAs deliver meals, pick up trays, wash dishes, anything I can do to alleviate a lot of work for them when they need to be with patients. Answer the phone when I can. Talk to the families, talk to the patients like Betty. It's just rewarding for me.
And it is not only those who are dying who need help, but those caregivers and those who are left behind. There are 2 very special sections of this facility aimed at young people and children who will, unfortunately, lose their parents.
This particular garden is designated for the children that we see that might be suffering some type of grief or loss, regardless of whether it's been from a hospice experience. And in the wall, the brick wall around the side, you'll see characters embedded, and these are characters that are from our book that we've written called The Garden of Hope, which is about the hospice experience through the life of grandmother Olivia, who's a butterfly. and they create works of art with the assistance of a local artist and our bereavement counselors. And in many ways, it's an avenue for children to express themselves and some of their emotions when they might not be able to articulate it. And so this expression through art is one of the ways we reach out to these kids.
Well, I'd like to give you this award today on behalf of Equitable, and it's for all the good work that you do. We've seen countless times where you've gone into homes and helped people that have been suffering, and I wish we could just give you a lot more.
Hospice and community care caught the attention of Equitable Life and Casualty agent Hal Bullard, who nominated this facility as an Ambassador of Caring Award winner. $2,000 and a beautiful plaque as a token of appreciation for the work done here.
We deal with a lot of senior customers, and several of them have passed away with cancer, and they actually came out to the home and helped them get through the process, and we just saw it was such good work, and I was just amazed that it was all volunteer, and it kind of touched my heart.
Oh, it's wonderful. It's wonderful. It allows us to do things for patients that we wouldn't be able to do without that money. To buy medications for people that can't afford to buy their own medications.
To help provide future services to those just like Betty, who is defying all odds, actually. Given only 3 to 6 months to live, she is still here now after 9 months, and her family couldn't be more happy with the care given.
I come see my sister. I'm with her. I share time with her. I know that they're doing everything for her. I never question it. I walk out that door, and I'm not worried. I know she's safe. I know she's with people who have compassion and love for her. I mean, really love her. They do, and I know they do.
And so thanks again to everybody associated with this great nonprofit hospice here in Rockhill, South Carolina, and congratulations to them again for being an Ambassador of Caring. For information on either of the organizations profiled today, log on to our website at goodtube.org. For now, I'm Doug Jardine, reporting in Rockhill, South Carolina for Profiles in Caring. Thanks for watching, and thanks for caring.